Bacterial vaginosis different from yeast infection. How? Bacterial vaginosis and vaginal yeast infections have similar symptoms but different causes and treatments. A yeast infection and bacterial vaginosis are both infections that cause vaginitis. Vaginitis is the medical term for inflammation of the vagina. It can lead to uncomfortable symptoms including itching, pain, burning, changes in vaginal discharge, a foul-smelling odor. Most females have at least one episode of vaginitis in their lifetimes. It is the most common gynecologic diagnosis in a doctor's practice. Differences. Bacterial vaginosis and yeast infections have different causes and risk factors, but both cause inflammation of the vagina, vaginitis. In fact, these infections are two of the most common causes of vaginitis. When a doctor diagnoses a cause of vaginitis, the cause is bacterial vaginosis in around 40 to 50% of cases, a yeast infection in 20 to 25% of cases, trichomoniasis in 15 to 20% of cases, not an infection in the remaining 5 to 10% of cases. It can sometimes be hard to tell whether a person has bacterial vaginosis or a yeast infection, but there are some characteristic signs. You can find similarities and differences in the symptoms of bacterial vaginosis and a yeast infection. Bacterial vaginosis causes. Vaginal flora collectively refers to the bacteria that live in the vagina. Usually among the vaginal flora, there is more of a type of helpful bacteria called lactobacillus than harmful bacteria. Certain activities can disrupt the natural balance of the microorganisms in the vagina, and this disruption leads to bacterial vaginosis. Risk factors for bacterial vaginosis include vaginal douching, smoking, having new or multiple sexual partners, having sex without a condom, a natural lack of lactobacillus bacteria. Yeast infection causes. Bacteria do not cause vaginal yeast infections. Instead, the cause is usually a type of fungus or yeast called Candida. Candida can be naturally present in the vaginal area, but lactobacillus bacteria usually restrict the growth of Candida. However, in some situations, Candida multiplies unchecked, leading to a yeast infection. Risk factors for a yeast infection include using hormonal contraceptives such as birth control pills, being pregnant, having recently taken antibiotics, having a weakened immune system. Diagnosis. To determine whether a vaginal infection is bacterial vaginosis or a yeast infection, a doctor may ask about the person's medical history, including previous vaginal infections which may have been sexually transmitted. Perform an examination to look for signs of infection and vaginal discharge. Take a sample of the discharge for analysis to see whether an overgrowth of harmful bacteria or fungi is present. Test the potential hydrogen or pH of the vagina, as a potential hydrogen of 4.5 or above can indicate bacterial vaginosis. Around 20% of healthy females tend to have Candida in their vaginas, so a positive fungal culture does not necessarily indicate that the fungus is responsible for any symptoms. Prevention. It is not always possible to prevent bacterial vaginosis or a yeast infection. However, doing the following can reduce the risk. Not douching. Douching can upset the natural balance of organisms in the vagina, increasing the risk of infection. Wiping from front to back. Wiping from front to back after using the bathroom helps prevent harmful bacteria from entering the vagina. Wearing cotton underwear. Cotton allows air to flow to the vagina and keeps moisture from collecting and creating an environment in which yeast thrives. Avoiding hot baths and hot tubs. Instead, a person could soak in a warm bath or take a shower. Drying thoroughly after washing. Rubbing the genitals can cause or worsen irritation, so a person should gently pat the area dry instead. Staying away from irritants. Avoiding harsh or scented soap products can help prevent or ease irritation.